headquarters, joined by Charlene and Jake. I'd like to welcome you all to this last clinic for the 2019 HPV Project ECHO. So a little pause there because I thought everybody would be applauding, but that's okay. We'll move on from there. We have a lot to get through today, so we'll get it started here. I'd like to, and I'm actually using the script, so it's an official closing. Welcome to the NJAAP HPV ECHO. This virtual clinic is brought to you by a cooperative agreement between AAP, NJAAP, and the Centers for Disease Control. The NJAAP HPV ECHO is a telementoring program. These virtual clinics aim to build a bidirectional learning community where participants learn from content experts and each other. Over time, the goal is that by participating on a regular basis, you've learned to feel that you have improved your quality improvement skills and gained self-efficacy around HPV vaccination. For education and quality improvement purposes, this ECHO session, like the others, will be recorded. So that you know, Project ECHO collects participation data for each ECHO session. The data allows the Meta Hub to measure, analyze, and report on ECHO movements and reach. On math and visualization activities and for decision making related. So we'll get on to the housekeeping. And so if you're not speaking, we ask that everybody, first of all, mute themselves. When we get back into exchanges between the group later on, we'll unmute everybody, but you have to also make sure that you're unmuted. By participating in today's
Michael.
Consenting to be recorded. We appreciate and value your participation. And to protect privacy, especially patient privacy, please do not provide any personal health information. If you have any questions at the end of this presentation, there are 2 emails at the bottom of the screen, but my recommendation to you is you send them to Jake. So again, please mute yourself. You can press the *6 to mute and unmute. Please take your time, communicate clearly during each session. And also, if you do put your phone on hold for having to leave or something, we want you to be on mute because, well, we don't all want to listen to that USAC information. So we're going to go through the roll call right now. We will go through this quickly. One person from each location will announce that who's on for that particular location. But we'd like for you to share with us in 1 sentence or 2 the accomplishment that you experienced through this 9-month project for which your practice is most proud. Tell us what that is. Okay, so to begin, Advocare West Deptford. Who's going to be announcing? Okay, well, we'll come back to Advocare.
Hold on.
Ah, Dr. Mishik. You worried me there.
Can you hear me?
We can.
Okay, so what we have found is that we have improved our process for improving our HPV vaccination rates as well as other vaccinations as well.
Terrific, thank you. And are you joined by Dr. Knessa and Dr. Hung?
Yeah, Dr. Hung and Dr. Statter have joined us as well. Thank you.
Fantastic. Chestnut Ridge Pediatrics.
Hi, this is Larissa Pilmar.
And are your colleagues with you?
Yep, I think Stacy Rosenzweig and Sarah are both on the call. I'm just calling and I'm in the hospital right now, but I think honestly what I'm most proud of from this is all of the knowledge that we've gained from this QI project. We've really been able to parlay into our practice. So like being able to have more in-depth and comprehensive discussions with our patients that kind of root out any of their fears and like anecdotal evidence about side effects. And I think that's been the most powerful takeaway we've had from this PY project. That's what we're most proud of.
Fantastic. Thank you for sharing. Cooper Pediatrics.
Yeah, hi. This is April Douglas-Bright and Susan Friedler. Can you hear us?
Yes, we can.
Fantastic. I think, we're proud of a lot of things, but, we're always proud when we can decrease, our missed opportunities, no matter what they are. And I think, one of the things that we really started doing was giving this vaccine a little bit earlier. We were clearly giving it at the 11 to 12-year visits, but now we're really starting to give it at 10. And that just, gives us even more opportunities to make sure that these kids are vaccinated on time. The other thing that we're always proud of is that, we always are able to get our entire team involved. And, we now have our nurses coming to us saying, oh, this kid needs an HPV as well. Can you put in the order? And it's just always nice to involve the entire team, the whole staff on board. And I think the only other thing I would add, I don't know if you want to add anything, Susan, I know that, one thing for sure is we've really been stressing this as much more as an anti-cancer vaccine. And I think that, using that language has really, I think, increased our acceptance rate for this vaccine, because we were struggling with some pockets of our patients, and using that language really does help to alleviate some of those fears. I think it just kind of hits the parents when you start talking about cancer and stop putting the emphasis on sexual activity,
That's terrific. And as we go through, as Ruth Kubernick takes us through the data review, there will be more opportunities to expand on that for everyone.
Great.
Dorothy B. Hirsch. Don't forget to unmute yourself.
This is Dr. Medina from the Dorothy B. Hirsch, and I believe Dr. DeBellis and Dr. Babcock are also online.
Okay, yes. Who unmuted me? Somebody unmuted me. Okay. Yes. I think
No, go ahead, Julia.
I think what we're most proud of here at the Dorothy B. Hirsch is just learning how to talk to parents about a vaccine that's not required by school. And it required a lot more effort, I think, on the clinician's part to really talk and address a lot of fears. I think having it be mandatory by schools made the acceptance of the vaccines a lot easier. But I think that I certainly learned a lot of techniques on how to really approach a parent when I didn't have that kind of school mandatory requirement behind me. And I think it really allowed me to really look at the way I approach patients about such information.
Fabulous. Thank you, Dr. DeBellis.
You're welcome. How about you, Dr. Medina?
Same, and the fact that we weren't vaccinating our kids, now that just opened a whole window to really protect the children that needed, well, that they're higher risk. And we're doing it at a very young age. So that's great.
Fabulous. Future Pediatrics.
Hello, how are you?
Fine, doctor. So what are you most proud of?
Possibly we have to admit, this is Dr. Noreen Amin?
Yes, Dr. Amin and Dr. Rashid, both of us are together today.
Yeah.
So usually we are in different offices, but today we're okay. So just the improvement in the vaccination rate, and I feel that the parents are definitely more educated than before. Their fears, their myths have been decreased about the vaccination. So overall, I really feel confident, and hopefully we will continue to do the same after the study is ended and, in future.
Fantastic. We hope that everybody will continue as well.
Sure.
Jersey City Pediatrics. Dr. Raha. I think you may need to unmute yourself, Dr. Raha. Okay, we seem to have a little bit of connection. Let us know when you get back on, but we're going to move forward because we got a lot to cover today. But we do want to hear from you, Dr. Raha. Rainbow Pediatrics.
Hello.
Hello.
Hi, this is Dr. Cavalier. I'm here with Dr. Hawk and Dr. Freund. Hello.
Well, welcome to all of you. And throughout the project, please share with us your most proud accomplishment.
Well, I think I agree with everyone that's spoken already that we have definitely increased the amount of vaccine that we've given in the office. I think by educating our parents about it being a cancer vaccine has been helpful. Also offering it at an earlier age, I think is also helpful. And also our nursing staff has been quite good about even putting in our charts before we even go into a room to remind us, hey, this child needs a Gardasil. So it's been a team effort, and I think it's been successful.
Terrific. Thank you so much.
Welcome.
Dr. Raha, are you on yet? Okay, we'll keep coming back. Rutgers Medical Group.
Hi, it's Beth Goodman. Can you hear me?
Yes, Dr. Goodman, we can.
Great. I think we're proud of a few things, a lot of which other people have mentioned. But one, I'm particularly proud of the teamwork that we've had at our practice in order to kind of meet our goals and make this an accomplishment. So I'm hopeful that we can do the same with other projects. And then again, more simply, our EMR, we made a very simple change in our EMR, which again, I think it's going to help our Gardasil rates, but also help with other things too that we want to accomplish.
Fantastic. Thank you. Summit Medical Group, Warren.
Hi, this is Dr. Jerry Suma. Hold on one second. I have to turn something off. Okay. Hi, this is Dr. Jerry Suma, and my partners, Dr. Rogers and Dr. Singer, are in the office. I am out of the office. Our group as a whole will monitor our rates of vaccination, and I'm happy to say that most recent meeting, we were able to actually quantitate that our vaccine rates have gone up. And I'd like to think it is in implementing many of the tools that you've suggested to us. Our nurses are phenomenal. They print out vaccines that they anticipate in the morning. And as busy as things get, they will bring it up to us, whether it's a physical or not. We are handing out the pamphlets at age 10. And for me, the most important part of presenting this vaccine is calling it the first anti-cancer vaccine and explaining how it may not impact the child now, but that you're trying to prevent these particular serious cancers when they are 30, 40, and 50 years of age.
That's fantastic. Thank you, Doctor. And Westfield Summit Medical Group. Hello, hello.
Hi, I'm here. I'm not sure. I'm at home. I don't know where my other people are. So I don't know, but I'll speak for all of us that we also were benefit by being able to see that our rates have gone up after doing this program. And I personally have implemented the earlier is better type of practice where I have been offering it, or talking about it at 9 and kind of like pushing it at 10 before they need their other vaccines, because I feel like the kids tend to put up less of a fight than some of the older teenagers anyway. And the parents are, you don't have as much other anticipatory guidance, so you can just kind of like slip it in there and it's done. and they don't have to think about it ever again. So, and I've been concentrating on calling it a cancer vaccine. And the people in my office all got on board with that, and it made it just seamless. So this has been a good learning experience, and also for me, I really liked seeing how other people do things at other practices, since I've only been at Summit Medical Group for my entire career. So that's been a benefit to me.
Terrific. Thank you, Doctor. So before we go on to today's presenters, I want to just go back and see if Dr. Raha was able to unmute herself. Are you there, Doctor? I know you're on.
Yeah. I'm here.
Good, fantastic. So tell us, what's your proudest accomplishment through the project?
Okay, I think we did very good in the last couple of months, but still we have been struggling a little bit with the few patients, but overall outcome is good. And nowadays, the language I'm using, that if you are trying to give the vaccine earlier, the percentage rate of protection against the cancer is much better than you are starting the vaccine. And also, not only that, you are going to take only 2 vaccines now, but later on, if you want to give the kids the vaccine after 15, you have to take 3 vaccines. And not only that you have your percentage is also going down the protection. So a lot of mothers are, as I told before also, that if it's been by the school, it will be much better. And now we are almost end of our project. So I'm going through with all the people who already got the vaccine, it's the second vaccine. So we are recalling them because they didn't make the appointment. So overall outcome is good.
That's fantastic. Thank you. I'm glad we got to connect with you. So we'll have some more time to talk about some of these individual pieces, and to guide us through that, as always, is Ruth Hubernick. All yours, Ruth.
Thanks, Michael. I loved hearing your accomplishments just now. Great reflections and thoughts, and lots of successes to celebrate. So, well, let's spend the next few minutes looking at the data from the last 9 cycles. And if I could have the next slide, please. Okay, so here's the measure we've been tracking for HPV initiation over the course of the project. And you know, even though we still have opportunities for improvement, you know, if you look at where we were as a group at baseline versus this last cycle, which is ticked up a little bit more, you know, it's almost double from where we started. And if you look at your individual practice run charts, that from the data from KETA, you're really going to be able to see exactly what you were just talking about as part of, you know, your accomplishments. I just want to point out a few things. For example, and it's in line with what I just heard from some of you, the Advocare West Deptford group, you know, I could see in your initiation rates the effort that you've been making as one of the practices focusing on starting vaccine as early, you know, like at age 10. And you've really had a steady increase in initiation and from baseline, and achieved 100% for the records that you reviewed this past cycle. So that's great. The other thing I like to see is that you're talking about your sustainability plan, and that you plan to continue to monitor your initiation rates every few months. You know, that's your plan right now on a quarterly basis to after this initiative, excuse me, it's over. So, you know, that's the type of planning and effort that we hope will continue with all of you after the formal ECHO project ends. Another thing, it was great to see that several of you are starting to and planning to use your flu clinics as opportunities in the next few months to improve your HPV initiation and even completion rates. Chestnut Ridge team talked about that. Planning to give, when you give flu vaccine, to evaluate for HPV as well, and if it's not given that day, to schedule an appointment for that. Also, it was discussed by the Summit Medical Group. Warren, that you were planning to do that. I wondered if anybody, like the Summit Warren Group, you've had a chance now to kind of get started with that. Is it working? And you know what, I'm gonna hold that question. We can come back to it during our discussion, but please, we'd like to hear more about how that's working for you. The Cooper team, you've realized that there are a lot of adolescents who aren't coming in for well adolescent or well child visits. And are using this as an opportunity from this initiative to recall them, to make sure that they're coming in. So I hope towards the end you can give us some insight about how that recall, what you're doing exactly to recall them and how that's working. Because, so I look at the rates and where you are now for initiation and completion, initiation in particular, but, from what you have indicated you're planning to do to sustain what you've put in place and even to continue to test, I expect in coming months that this is going to continue to increase. So great job. Next slide, please. Looking at the completion rates. We have polling questions thrown in here this time. So I'm going to pass this to Jake to initiate the polling. Or Michael.
Okay.
Polling is now live.
So take a look at the questions. You got about 10 seconds to answer. Okay.
All right. Let's see. Okay. Now, I don't think this was the case when we started out, and we'll, after we do the post surveys, we'll be able to actually share that with you. But seeing that this is happening earlier rather than waiting for just the recommended ages, so you've all been working hard on that, and it shows. Even in terms of just starting those discussions earlier, even if it was a missed opportunity, to be able to make sure that it's going to happen in a timely fashion. So great job. Next slide. So let's look at the completion rates, which have, nice increase over the course of this initiative, almost to the, you've hit above the goal in the past cycle. I can't call it a trend with only one data point, but to me, there's been a lot of effort made for reminder and recall, scheduling appointments before the patient leaves, after you've initiated the series, to make sure that they come back in a timely fashion. Now to look at other opportunities, sick visits or flu visits. Future pediatrics, you've maintained 100%. For the last 5 months with this measure. Jersey City Pediatrics has done that for the last 4 months, as has the Summit Medical Group, Warren. To me, that means that you now have a system in place to make sure that the HPV series is being completed in a timely fashion. I'm happy to see that both the Cooper Peds and Rutgers group, that you're on the rise again for the patients who are completing their HPV series. So good effort and good job. Next slide, please. So we have another polling question. As a result of this initiative, you can check all of the things, if it's more than one, about have you educated your staff, implemented methods to increase rates, and or implemented methods to because of capturing more opportunities or increasing visit attendance by reminder recall and other strategies. So if you could reply to this, and we will see how we made out. All right. So how awesome to see that the amount of multiple strategies that are going on as a result of this initiative. The education of staff, reminder recall, and other methods to increase visit attendance, and the strategies such as use of standing orders, prompting physicians, and other such ideas and strategies that you've been testing and implementing. So great job, great job. So if I can have the next slide. So we're going to look at the missed opportunity that we've been tracking over the course of the initiative, and we see that, you know, look where you started at baseline with the number of patients whose records you reviewed, who were eligible to receive vaccine. You know, over almost 70% of them had those records reviewed had a missed opportunity, as opposed to at the end this last month, you know, about 40% overall. But so really there's been a lot of effort made, and let's look a little bit at the individual types of missed opportunities that we've been tracking. So on the next slide, this has been one that, you know, that you've continued to work on, struggle with a little, with the missed opportunity being because the patient or the family refused as a result, and declined the vaccine. But, you know, I wonder if some of this has to do with the fact that you're really talking about it much earlier. And so is it really a refusal? You know, maybe it's a refusal at this point, but with the messaging that you've been giving, that you know, that you indicate you're talking about cancer, and you're talking about benefits of giving the vaccine earlier rather than waiting, that I would expect that this is, you know, one that you may be able to further reduce those rates as you move forward. The next category of missed opportunities having to do with postponed. This is lower and you know, than those who just out and out declined. Postponed to me also means that I've been seeing in the reports, the PDSAs that you sent forward in the last month, the Rutgers group, great job that you're looking at, you know, is it an issue with people declining, or is it is it postponing? You know, what just deferred like this, postponed? And what are the reasons? And that you indicated you're increasing your documentation in your EHR so that next time this patient's seen, that notice there is a prompt. And if it was, well, you know, maybe at the next visit, you're going to use that opportunity. And that's going to really be, you're going to see, as you indicated, in the future, that you're going to have more patients start the series as a result of knowing that there's already been you have an assessment that there's been a discussion that's been started with the family and where you need to pick up on the next time. That's also true. Rainbow Peds. You know, you had an adolescent who got Menastra vaccine and is coming back in a month for the Men-B vaccine, and you've made a note that that's going to be another opportunity you're going to use to talk about HPV when they return in a month. So those postponements, you know, I mean, you're using them as prompts, you're using them as discussion points for the next time out. So great job with that. Just overall, I do want to point out the Jersey City, Dr. Raha, the last 4 months, you have vaccinated everybody, whether they've needed an initiation or completion. So you've had no missed opportunities for the last 4 months. So nice job with that. Dorothy B. Hirsch, you know, you've reduced those who are refusing vaccine. So, you know, your discussions, your visual cues that you're using with families are really proving to be helpful. So good job. Next slide. Contraindications, you know, that's not a reason for missing opportunities. That's not one of the categories that's an issue for you all. And the last category where we looked at when you chose other as the reason, that, you know, some of that, actually those reasons for other have declined in general because they're either primarily postponement or deferment or declining. But that may be, I'm seeing a lot less reasons that you didn't identify the patient. Those are, when we started this and we looked at reasons for other, most of them had to do with because you were missing the assessment that it was a patient who was due for the vaccine at that visit, or that it wasn't being offered at a certain type of visit that the patient was seen for. And those are not the reasons. You are now doing a good job recognizing who needs vaccine and also not just offering it at one type of visit. Again, I applaud you for the work you have done. You know, this is, there's the opportunity beyond the scope of this initiative to keep going. So great job. Okay, so one more polling question. So as a result of this project, do you feel more competent in introducing the HPV in a way that optimizes parent confidence in the vaccine, communicating with the parents, families, and caregivers who may be hesitant, and communicating with the families and caregivers who decline or delay the vaccine? If you could answer, you can check all that apply. Feeling more confident than you did when you started. All right. Okay, great. Oh, okay, I can go, I'm done now. Good job. It shows in the type of PDSAs you've been doing and the case studies and, you know, your efforts. So thank you all. Celebrate these successes. So I guess if we can come back to some of the things that I had, you know, I wondered if some of the teams could talk about. The Chestnut Hill or the Summit group, Lauren, you know, using the flu clinics or when patients are coming in for flu vaccine. How's that going with, you know, are you finding that it is a good opportunity, or what's happening with HPV as a result of that?
So, I mean, I just looked at this past week, but from what the patients coming in, a lot of them already had the vaccine started or completed for the week that we've done, or that I've looked at. So really, we haven't had too many opportunities to catch kids that need it. But it is, again, I think a great idea because we do have lots of food clinics planned ahead for the next month. Yeah.
I know we have to put the orders in, they'll put it in, and so when they put the orders in, if the nurses put the orders in and I look at it and it's a teenager, then I've been going to their immunization record and looking to see, do they need it, and then adding that on if they do.
Great. Great. Others who are doing this?
We've been concentrating more on getting the second immunization rather than vaccine initiation, just because that tends to be like a more protracted conversation, and if parents aren't expecting that, then it becomes a little bit more dicey. But I think for us, it's just a little bit about like training RMAs to look for that as well and making it part of the workflow.
Good points. Good point. Anybody else on that topic of additional opportunities in the coming months?
Can I just add, for Summit Medical Group, we have separate flu clinics where they really just do like flu. So if you know a child does need their Gardasil at the same time as their flu, you actually have to book the appointment differently. So I'm kind of curious how my other colleagues in different offices have been dealing with that. Or have you, I don't know, because our nurses are like overwhelmed in my office with the flu vaccines as it is. So I'm just curious how you guys have been dealing with that.
Anybody? You mean to make an appointment for them to come back?
Yeah, well,
or any other vaccines that they're missing?
I mean, the flu clinics are like kind of separate from the office immunization appointments. They're like two different things, and so they only give that flu vaccine at those kind of rapid turnover flu clinics. But I mean, I was over the summer telling people to book their second HPV appointments if they needed them around this time in the fall, and then when the nurse kind of says, hey, you know, this person's coming for their HPV vaccine. What I do is I put the order in for the HPV vaccine. I see if they haven't had their flu vaccine. I stick a flu on there. And if they want the flu vaccine, then they get both at that time, or else they just cancel the flu vaccine and just get their HPV. But I'm just curious if you guys are doing it differently. And I probably could have asked you this last night when I saw you, but sorry.
This is Emmanuel Lerner from Rutgers Medical Group. I mean, I would have the same issue here if I really wanted to go ahead and give the, I mean, the flu clinics are booked for like every 5 minutes. You know, everybody's getting a vaccine. If they have to like check every single one, make sure to see if they need the HPV vaccine, I would agree with you. We would also have a really hard time doing it. It's a great time, like, you know, every once in a while I'll tell somebody, oh, when you come back with flu vaccine, you're going to have to pay today. And the nurses always come back and say, you can't do that. You know, it throws everything off because they're drawing up the vaccines, you know, every few minutes they have another patient that they have to give vaccines to. So I agree with you, it's an issue. And with all the documentation, having to put in lot numbers in the computer and all that kind of stuff, it just takes extra time every vaccine.
So what I challenge you to do is maybe think about, is there an opportunity to make sure that those patients who need other vaccines, that before they leave the office or where the clinic is being held, either schedule that appointment for them to come back, or to be able to make some kind of note for recall to do that. Once because you've done a good job, you've assessed them, you know that they need other vaccines, and just how do you then make sure that that actually happens? So that could be a test to do.
Yeah, but I also do like, I mean, also I try to tell them if you need, so now I tell them if you need that hepatitis A vaccine, make it at the time that you can also get the vaccine. If you need the HPV vaccine, come back at a time that when you come in for your flu vaccine, when you come in for your HPV, get the flu vaccine too. So it could be done the opposite way.
Yeah. Yeah, so whatever would work best, you know, try doing something a little differently. All right, anybody else?
Future pediatric Dr. Rashid. I would like to thank the American Academy chapter for this initiative. Actually, we learned that with some extra attention and capturing opportunities, we can definitely do much, much better than we do. Originally, it was always claimed to be by health insurances in the 60s or something around it. Now with this like kind of project, we approached the 100% or near the 100% on HPV. So definitely we can do better on all other vaccines, as I can see, just by alerting everybody to look into the vaccine record every time the patient comes in for sickness, for checkups, for school, completion of vaccines, for physicals, for sports, whatever. I noticed that many times the patient comes in because the school wants the meningitis, then he didn't take the HPV, or possibly he didn't take other important vaccines also. So there is always a chance to do better on all other vaccines, actually. And HPV was just like a kind of a wake-up call to everybody to see that if the patients are truly taking their vaccines, they come back and forth to the office.
Great message. Thank you for sharing that.
So, thank you.
Thank you. Okay. I have one other question with the Cooper team, Dr. Bright, Dr. Fiedler, about the recall that you're doing now for well child care for adolescents. What type of recall are you doing? Are they phone calls? Are you doing text messages to the adolescents? What are you doing, or what's working? It's two different questions.
So right now we're having our division coordinator try to make phone calls, direct phone calls. And we were actually doing this as part of a project we were doing for mental health screening. And as part of that project, we realized that we just had, a significant amount, well, not as significant, but certainly enough of a percentage of our adolescents that we just hadn't seen, in a couple of years. It's just so difficult to get them in. And so we just figured maybe we need to call for these adolescent visits and kind of kill two birds with one stone. So our division coordinator is committing a little bit of time every week to call these parents to try to set up appointments to have them come in. And then we can also discuss the HPV vaccine at that point in time.
Great opportunity for the well care, preventive care. Great, thank you. All right. Anybody else before we move on to, we're good?
Yes, hi. Jerry Suma, can you hear me?
Yes, but there's an echo.
No, you're not coming through.
Now I can't hear you.
Cannot?
Now I can.
Okay, can you hear me now?
Yes.
Okay, a thought that I had was to connect with our OBGYN, because we are a multi-specialty group. And when the young ladies go to get their GYN exam, et cetera, that perhaps they might be more alert and saying, gee, I see you had your HPV and it's 6 months, would you like us to provide it? But I don't know if they have it in stock. So I guess I'll have to just explore that. I just thought of it as another method of capture.
I think that's a great idea. Maybe you can test doing that with one of the OBGYN docs and see what, how that works. Test doing it with for a short time, maybe over the course, I don't know whether you wanted to say a week or, as long as a month, just to be able to see what the impact is.
Yeah, okay. Thank you.
Great idea. All right.
Okay, so we start moving to the final format of this afternoon. These slides will all be available on the attestation, will be available first thing tomorrow morning, where you can download them. But as I'm sure all of you are aware, it's a fairly simple process. Here's what I want you to know about this process, is we, with the end in mind, would like to make sure that we can attest for all of the participants by November 15th. In order to do that, we're going to need information from you by the 10th of November. So we'll talk about what that information is shortly. We'll just go quickly through these slides because they're really just 3 areas that we want you to know. Of course, this is how you're getting to the ABP site. Once you're there and you're clicking on it, you can go ahead. And then we're looking at, my MOC dashboard. And when you've clicked on that, you're going down to the next screen. And at the bottom, you can see you're looking at part 4. This is a quality improvement project. And then you'll go from there. That will take you into, there we go. You want to get the attestation form. And this is what you're going to be working off of. And in order to get to the right one, looking at number 5, you're going to be going down to NJAAP Project ECHO. released from there, and then you'll be able to print out your form. And there are really two important areas that you have to make sure once that form prints out. And since I only play a doctor in the office, I can't print one of these forms out. But there are a series of check boxes that you have to answer. And it's just checking it off, reading it and checking it off. Make sure that you check mark each one of those. If not, then we have to start it again. We'll have to send it back to you and so forth and so on. So that's number one. The other critical component of this is the putting in the correct date. You cannot fill out a date until you hear from us. The only way that you're going to hear from us is you have to complete the pre-post survey. That's the last requirement for MOC credit that needs to be taken care of. So you will go into there, we will fill out that pre-post survey, we will record that here. At that point, we will contact you to let you know that you can now go ahead and complete your attestation form, and then you will send that to us. And then the next thing that you would hear, we're able to enter that into the ABP site within a day or two after you get it to us. You will hear directly back from ABP that you have been attested and that your credits are there. So there are a few of you now on those attestation forms. The project leader can sign off on those. You have to send them to us. But if you don't mind, Dr. Mishik, I'll use you as an example. Let's say Dr. Mishik is attesting for all of the participants in his practice that signed up for MOC Part 4. He can attest from them, but his attestation has to be signed off by us. So if you have any questions about that, everybody can send them to us, and we can do it that way. But that's really the gist of the whole thing. And again, these pieces will be available on Kita. You'll be able to download it, print it out, go step by step if you need to do it. But once your credit is posted, as you can see in the yellow highlight, ABP will send you an automated email telling you to check your portfolio. That's how you will know that has been done. If you have any questions through that process, simply call us, email us, reach out to us. We'll help you through this. It's a pretty simple and smooth process. So we'll leave this portion of it there, give you a chance to kind of review through it, download it, ask it. If you have any questions, again, just reach out and call us. Okay. So at this point, I thought, we heard all of this great information from each one of you. And so on this side of the screen, there are a number of people who are just so pleased to have had the opportunity to work with you. So we're going to afford each one of them a little bit of time here, and I'd like to start with Ruth, your thoughts on closing remarks.
Okay, I've had plenty of time to talk today, but just a few messages. One is that this collaborative has just been the beginning of the journey that you're doing to increase your immunization rates for patients for HPV vaccine. So I really encourage you to continue to use the QI methodology to test your ideas and your strategies for continuing to improve the rates and reduce missed opportunities. And remember that you need to hardwire the process improvements that you've made so that they're really going to be sustained long-term. That you have a process owner whose responsibility it is to continue to monitor. You'll have access to Kita, even if you want to, on a every 3-month basis, go in and look at 10 patients during the past month for these measures. And print out your own run charts and share the data, post it in your lunchrooms and your meeting rooms, and continue to talk about this keep it on your agenda, your meeting agendas and how you're doing. Make sure you have written protocols in place for these system changes that you've made, and that you have the ability to train and orient new staff. You know, great to hear nursing staff and other staff members have gotten involved. Make sure it's part of that everybody knows when they come in about how you do this and the messaging that you do. And you can use the ECHO recordings from previous sessions that are posted in the workspace of KEDA as training, as tools for new staff and new physicians, clinicians who come in. Those of you who are part of a larger organization, I just want to remind you to make sure that you spread this practice-wide, organization-wide, so that there's a standard of care related to the vaccinating of adolescents. Last message, continue to celebrate your successes, because I know this is hard work. Change is hard. You've done a great job, and as you move forward, continue to celebrate your success. So thank you all, and keep up the good work.
Thank you, Ruth. Dr. Susan Brill.
Hi, everybody. So, you know, first of all, this was a really good last session, because I love that we got a lot of closure, got all the input of the participants. And one of the things that really struck me today was how many patients we've actually impacted with this project. Because if you think about that, there's 10 or 12 groups, the number of kids, you know, looking at the ends on all the data points, you know, the number of kids that got that vaccine that may not have gotten it otherwise is enormous. And one of the things that being part of this type of QA project, I see the power in being able to educate so many people in a very time efficient way. And I'm really happy to have been a part of it. I sort of kept quiet most of the time, but I hope that the comments that I've made have been helpful for everybody. And certainly, as you know, Michael said, we're not going anywhere. We're here. Please reach out to us if you guys have questions or concerns or even funny, you know, difficult cases. The main learning points I got were, you know, to starting the vaccine at 10 and also to unhook it from whether kids are sexually active or not. And I think those have been two really powerful tools that have allowed us to improve the vaccination rates and see the kind of data that we've seen. And I think everybody did a wonderful job, and I've been really happy to be a part of it.
Thank you, Dr. Brill. Dr. Varghese.
Hello, everyone. I just wanted to reiterate what everyone else has said, but really what this program has really shown, I think, and I hope the message has gotten across, that it's a team effort. And so it's not one person in the practice who is responsible for this. It's really getting the nurses, the medical assistants, getting the front desk staff, everybody on board. I wanted to echo what Ruth and Dr. Suma had said too about working with other practices in terms of OBGYNs and getting your OBGYN colleagues. And for those of you who aren't part of larger health systems, if there are local OB-GYNs that you know, trying to work with them in terms of improving HPV vaccination rates in your local area. And from my standpoint, I also, similar to Dr. Brill, stayed quiet much of the time, but I hope that I reiterated what we're trying to prevent here. Cervical cancer, but also high-grade cervical dysplasia, which I see much more of than the cervical cancers, that really leads to a lot of emotional stress, physical stress, financial stress for patients. Literally, I'm dealing currently with a patient who had an abnormal pap smear, needed biopsies, has a high deductible insurance plan, and each biopsy apparently costs is charged $4,000. So, you know, these are real stresses, and beyond the dealing with the potential for a precancer or cancer. And on those days when your energy level is lacking, because I totally get that too, when you really don't have it in you to talk about HPV vaccination for all 20 patients or so that could potentially be eligible for it, pick a handful and still target them, because we all have those days, but just don't let it lag completely, so that it really does become a habit to discuss it. So thank you to everyone for all of your great work in helping to prevent cervical cancer in the state of New Jersey.
Thank you, Doctor. And lastly, our principal investigator through the project, Dr. Puthamanam Radhakrishnan, more commonly known around these halls as Dr. Rad.
Thank you, Michael. And I want to congratulate everybody on an amazing journey. I'm pretty sure you guys had as much fun as we did. And I really want to congratulate you on putting up with Michael for these last few months and all his calls and his torture. Anyway, so I just wanted you to take home the fact that, you know what you've learned or done over here is something you need to continue to do. We have continued to do that in my practice, where we've taken this, what we've learned from HPV ECHO projects and the MOC project, onto other immunizations. Like Dr. Fowd said, it's very important. Also, I've instituted just checklists. Every now and then we'll pull up the next 10 patients coming in and take a look and see, are we doing what we're supposed to be doing? Are things we're missing? And for those of you in a smaller practice, it's very important to know that this data is important because it does affect your reimbursement. So make sure that the MCOs that you participate with have this information, and that what you are finding in your practice when you're doing your own audits is matching what they're coming to you with the information. I found that the #1 reason why they have wrong data is because a lot of our patients we forgot to take off of our NGIS list, or you didn't disenroll them. So it looks like your denominator is huge when these patients are no longer your patients and they've already moved on or lost the insurance, and they're still on the NGIS list as your denominator. So please make sure to have somebody check this every month to make sure your denominator stays true to your practice. It affects your bottom line, and it affects your practice finances. So important thing to remember. I did want to also mention this month's the Journal of Pediatrics, the American Academy of Pediatrics Journal, on page 44, very interesting. It's about the HPV vaccine delivery practices by primary care practices. And what they talked about was actually what kind of a difference did it make from going from a 3-vaccine routine for HPV to the 2-vaccine. And anecdotally, they found that it increased their rates of completion because they were able to complete 2 vaccines and not have to wait for a person to come back for a 3rd vaccine when a lot of them didn't come back. It was also interesting that they were saying that it was easier to get somebody who's 13 to get the vaccine than somebody who's 11. I think, Michael, this is the time that we should probably publish data also and show that we've started, a whole group of people starting this at 9 and 10, and our rates really have significantly improved. So I think that's very important. It's a great job. Congratulations to all of you for finishing your MOCs, and we'll get this done and you'll get your MOC points soon, hopefully.
Thank you, Dr. Red. Jake.
Well, I would just like to thank every single one of the practices for participating in this project. This was my first major project in which I was a coordinator and worked very directly with all the practices. And all of you were an absolute pleasure to interact with. I had a lot of great interactions with several of the physicians on the line right now, and with many of the nurses and office coordinators. So from the bottom of my heart, I really want to say thank you for making this just a great project for all of us.
Thank you, Jay. And so they left me for last because they knew there would only be 2 minutes left. So I'd like to take a little bit different track. Of course, I feel the same way as the Hub members and Jake. It's been an absolute pleasure and honor to work with each one of you. What I would like for you to do over the next few days is I'd like you to go back and look at the data review, look at the initiation, and look at the completion, and look at the change. And then I want to use as a pull together of that from a comment that Dr. Rashid made. And his comments largely focused around the idea of a pinpoint focus on being able to do this. From my perspective, I call that buy-in. And when you go back and look at those 2 numbers, now we don't know what the denominators are, but I would subscribe to you that if the efforts are continued into next year that you've achieved in this 9 months, that each one of you has the potential to achieve the Healthy People 2020 goal of 80% completion UTD rates in the year 2020. I think that would be a remarkable story for each of you to be able to share with the families for whom you care. On that note, again, thank you so much, and we look forward to speaking to you in the future. You've got the evaluation link. Thank God that Jake's thinking of these things. Please complete that and get your evaluations, your pre-post into us as quickly as possible. Thank you, one and all.
Thank you.
Thank you.
Are we muted?
No, I unmuted him.
Thank you.
Thank you, everybody.
Bye.
Can you send that link as an email too for the Survey Monkey?
Yes,
We'll
Dr.
go
Bender will go out.
Oh, thank you.
So very good. Meet the meeting.
I can close it.
Yeah, we can close.